My name is Tim Maria, host of Digital Health Live here at CES 2015, probably the largest event in the world for innovation and new technology. Dr. Joseph Roberson, who's with Vital Connect, was here with a really cool panel. How you doing?
Doing well, thank you, Tim. How are you?
I'm good. I'm good. Still hanging in there. It's been a pretty intense day, but there's just some amazing innovation happening in here. And tell everybody about your background.
You bet. As I said in my talk, I wear 3 hats. I'm a surgeon, so I have the pleasure of doing that several days a week. And I also run a medical practice, so I have the business aspect of medicine. And then today, what we're talking about is a company that we were involved with starting about 4 years ago called Vital Connect. And that is firmly in the center of this revolution we're talking about.
So Vital Connect, I remember, is basically has a patch that I can put on my body, and there's a lot of complexity with doing that because you have to work on the right glue and the right types of sensors. And what was the goal of that innovation?
Yeah, I guess the vision of it is the right way to start. Is we thought if we could come up with a way to measure vital signs that are placed on a patient at home and that take them through an interaction in the medical care field. Say, for example, they had chest pain and they were transported by ambulance to the hospital, hospitalized and then sent home. That we would want a patch to start at home, stay with them through the entire hospitalization and for several weeks after discharge, that delivers continuous data that's then reposited in the cloud or on the web so that doctors could use that data. And that would improve, we feel, the quality of care and outcomes.
Great. Cool stuff. So the panel, you wanted to expand upon some things, so people will be able to download and watch the first part of the video, but I want to give you some more time because it's really interesting.
Yeah, I think that in the 10 minutes that we talk, it's got to be very succinct, but some of the things I would fill in for interested parties is that the algorithm development of taking those multiple data streams can help me as a physician to answer questions that I can't answer otherwise. So for example, in the United States, about 8 to 10% of the population has a condition called sleep apnea.
Yeah, my stepdad has it.
Okay. There are a large number of wrist-based or bed-based devices that measure movement, or actigraphy-based devices to look at sleep. They are not very accurate. In fact, in our studies, they're about 20% accurate. So how would you use our patch to be able to tell whether someone has sleep apnea and should seek treatment? So we did a study looking at about 85 patients who had a polysomnogram, that's the medical gold standard grade test, and concurrently gathered data from the patch. So we take those data streams, some employees who are smarter than I am look at it from a mathematical standpoint and come up with an algorithm or a mathematical formula to be able to predict whether a patient has it. And then we turn that back around, restudy it in the clinic, and then we determine its sensitivity and specificity as to whether it's accurate. So we hoped for 60 to 70% accurate. We got 98%. So it's phenomenal. Now, that's an application with our patch. We don't plan to take that out and start a company with it because we are a B2B business model where we want to sell patches to partners, but we can license that or use that. So that's one example of what's happening. There are now about 50 such algorithms with our product under development. That's what's going to change things. So, right, docs they've had it with a huge fire hose of data pointed at their head.
Yeah, it's like, oh, the doctor's just going to manage to figure out how to swallow a fire hose.
That's right. It's not possible. And it's also risky. As my talk said, it's something that annoys physicians. All of my peers are to the point where if another patient brings another device in and asks me to interpret it, I'm going to throw it through the window. So it has to be that we start answering real questions with real data that you can point to and say that's the accuracy of it.
It's just a tough space when consumers are showing these consumer devices, like you're saying, and doctors are getting beat up. And they don't deserve that.
It's one of the things that bothers me about this industry, and just some friendly advice, putting my physician hat on to the industry itself. It's not accretive to accuse physicians to rah-rah, we're going to run in and change medicine, and physicians don't know what they want, and they all make the misdiagnosis. It's a tool for physicians who are motivated to care for their patients. So when it's going to really reach the tipping point, and we've had this flurry of consumer activity, but as you know, most consumers after a while stop kind of using their device because they don't know what to do with it. When it really gets going is when physicians have access to the data and the medical community begins to develop the algorithms. That's coming. In fact, we think in the next year or two that's going to really go. And then it's a whole new ballgame.
That's the question I've been asking is when does that happen, and then it starts to scale?
Right. Well, it's happening now, and we have certain partners that are actually taking it into the medical realm. For example, we've catalyzed the space by doing some of our own algorithms. Sometimes our machine learning specialists work with a partner to develop an algorithm, and sometimes partners say, we've got this under control and have our own people, we want to develop it. All are fine, and that's happening actively. So.
How do partners connect up with you?
The best way is through a website or through my email, jroberson@vitalconnect.com. We're in Campbell, which is in Silicon Valley, and we're about 65 or 70 people. We've been at this for 4 years. We are at the point where we've been selling the device for 8 months and are actively signing agreements with people now, so it's a good time.
Nice. So what's next for you?
Next for me is to turn this into a very large company. I think, to be honest, though, that it's likely a large company that has better reach than us will actually take this into the field faster than we would. So I wonder what will happen with that. But either way, it's going to be a win.
I think what's really cool is basically the doctor who's an entrepreneur that can work with entrepreneurs and kind of mold those together to really create solutions that seem like they would actually work.
You know, I've learned this. I think I bring things that people coming from the tech industry, maybe cell phone or other things, they don't know and realize about how to sell to doctors and penetrate the market. And there's probably more the other way of that tech brings to me that I just don't have a clue about. You know, how you make that, what you can do. But the fertile field is to get those two minds in one room and look at the problem and say, here's what I can do, and here's what I can do, and then suddenly the light goes off, right? And then that's really the genesis of this company, is to bring technology to medicine, which, as we all know, is woefully behind.
And CES is an amazing confluence of these different puzzle pieces that are flying by, and you could be getting a coffee and turn over and see some amazing technology here, you know, and it's all here.
You know, I mean, thanks to Jill for doing that, right? I mean, I can't imagine taking this whirlwind of stuff that's going on and trying to put together a presentation. She's done a great job of it, but that's what this is about, is learning about what other people are working on and what they can do. And, you know, there are a lot of wow moments walking around or hearing or talking to people at this conference.
Yeah, so we should thank Jill Gilbert, the Living in Digital Time teams, and everybody else, our volunteers that are putting this all together. Joseph, nice to meet you, and thanks for being on the show.
Thanks for the time. Take care.